Let's do an introduction to anatomy. We will learn following terms in this video. Anatomical position, directional terms used in anatomy, and anatomical planes and section. Let's get started with anatomical position. Anatomical position help to accurately describe the location and direction of person. The person in anatomical position have following appearance: face facing forward, arms down at the side, palms of hand facing forward, and thumbs pointing to the side. This is always from the viewpoint of patient. Now let's move forward to anatomical terms of position. This list of terms will help you to accurately know where one anatomical structure is in relation to another. These terms are commonly used in medical settings. Anterior. It is also known as ventral. It means towards the front. For example, sternum is anterior to vertebral column. In contrast, we have posterior or dorsal. It means towards back. For example, vertebral column is posterior to sternum. Keep in mind that all these are explained with reference to anatomical position. Superior. It means towards the top. For example, eyes are superior to nose. In contrast, we have inferior. It means towards the bottom. For example, lips are inferior to nose. Cranial or cephalic. It means towards the top. For example, skull is cranial to the neck. Then there is caudal. It means towards bottom. For example, neck is caudal to skull. Cranial and caudal are used for brain and spinal column. Medial. It means towards midline. For example, nose is medial to ear. Lateral. It means towards the side, away from midline. For example, ear is lateral to nose. Superficial. Towards the surface. For example, skin is superficial to bone. Deep. It means towards inside of surface. For example, bone is deep to skin. Now let's move to our last pair of definition. Proximal, which means situated towards the origin of body. For example, elbow is proximal to wrist. Distal. It means situated farther from the origin of body. For example, wrist is distal to elbow. The reference of origin in this proximal and distal is shoulder joint. Now we will talk about planes and section. The body is sectioned along a plane to study internal anatomy. Plane is an imaginary line that cuts the body into sections. Section bear the name of the plane along which it cuts. For example, cutting in sagittal plane results in sagittal section. Body is sectioned most commonly into three planes: sagittal plane, coronal plane, and axial plane. Let's start with sagittal plane. It is a longitudinal line which cuts body into left and right part. It helps to study anterior and posterior relation and superior and inferior relations within the body. We study sagittal plane into two ways: mid-sagittal section and parasagittal section. Mid-sagittal section divides body into equal parts, where parasagittal section divides body into unequal parts. Coronal or frontal plane. It is also a longitudinal line, but it divides body into anterior and posterior parts. It helps to study right and left relation and superior and inferior relations within the body. Our last plane is axial plane. It is a horizontal line, also known as transverse or cross section. It divides body into superior and inferior parts. Thanks for watching and do subscribe.